Well, good day, and I'm Ruth Bowick, and welcome to viewers of Healthcare for 55 Plus. Today, my guest is Brandi Milko, over here on my left, and she's here at the Patterson Clinic, and she's one of many that is part of the Sunset Family Health Team. Now, this informative program is thanks to Shaw Spotlight, and I'm so pleased that Shaw Spotlight has invited me to be the interviewer with a number of professionals involved in pertinent health care for the area seniors here in Kenora. And I will add that I'm positive everyone viewing this show, not only seniors, will glean a lot of wonderful information on what Family Health Team has to offer. We in Kenora are very fortunate being able to boast such a great plethora of informative guests for this show. So to get started, I am delighted to introduce Brandi Milko, a registered nurse. Welcome, Brandi, to this. And we're going to just get right into it, and don't be nervous or anything like that. You know, I don't bite. Okay. So first of all, we're going to kind of talk a little bit. We're on the theme of hypertension, right? Mm-hmm. So I think blood pressure is a part of hypertension. Right. So now, what do these numbers mean? There's so many. There's like systolic or something, and some other, and then there's 2 levels or 3 levels. Would you like to explain that for me, please, or for the audience? Mm-hmm.
Oh, sure. And I'm glad you asked. This is a really common question. Most people don't know what the numbers mean. So blood pressure is the amount of pressure that is being put on the walls of a type of blood vessel called an artery. So what happens is there's 2 numbers, right? The systolic, that's the top number, and that's the amount of pressure being put on your arteries when your heart's pumping out that blood to release it to the body. Okay. And then when your heart relaxes and fills up with blood, that's the bottom number. That's the diastolic blood pressure.
Oh, okay.
Yeah, so you should always see 2 numbers when you get your blood pressure read. And that top number, we want that one to be in the doctor's office less than 140, and the bottom number less than 90 in the doctor's office. However,
for the other, like 140 for the
systolic, the top number, and the bottom number less than 90.
And that's the what?
That's the diastolic.
Diastolic.
So
okay.
Lots of people have heard that a perfect blood pressure reading is 120/80. That's kind of what we're aiming for. If you're a person living with diabetes, you need to have your blood pressure less than 130/80. So a little bit lower than the average person. And there might be different targets depending on your age or what your risks are. And that's something that you could come talk to me about or about with your family doctor or nurse practitioner.
Well, I was just thinking, like, for a diabetic, why will her blood pressure be different than a non-diabetic?
Right, that's a good question too. So part of one of the risks of having diabetes is that you could have kidney damage. Some of the drugs that you take as a diabetic are hard on your kidneys, and you want to have good kidney function to have good circulation with diabetes. Okay. So having a lower blood pressure, we always say that protects your kidneys. And so sometimes people living with diabetes, they might even be on a small dose of a blood pressure pill to keep their kidneys healthy.
Oh, okay. So that's all right. So right now I'm on, what is it called?
Ramipril.
Ramipril. So I think it's 5 milligrams mg, is that right?
Yeah,
So that's a little higher, because at first I was on 2.5 or something, so I guess that didn't work. So
right, and sometimes that might have to happen, and that's one of the things that might happen if you come to the blood pressure clinic to see me, is we measure your blood pressure here. A really important part about checking your blood pressure is making sure it's done in the right environment. So it's okay to check your blood pressure in the community. That's another common question I get. Is it okay to check your blood pressure at the pharmacy?
Yes, they all have them now.
Yeah, do those monitors work? What about at home? Is my home monitor accurate? So actually, the new guidelines from Hypertension Canada recommend that out-of-office monitoring is really good, and we should be doing it either with a home monitor you purchase or with something called an ambulatory blood pressure monitor.
That's the pharmacy ones.
Well, the pharmacy,
really.
that's a different one. The ambulatory blood pressure monitor,
what is that?
That's one where it goes on your arm and you set it up. I set it up here for you in the office. You wear it for a full day, a 24-hour period, and it automatically checks your blood pressure for you.
But it
stays with you.
It's on with Velcro or something?
Yeah, I don't have one here, but it stays with you on your arm and has a fun little battery pack.
I don't have to keep, say I had one, I wouldn't have to keep track. It keeps somewhere.
It keeps track of it
somewhere
for
those figures are going running to you.
Yeah, so your doctor might ask for one of those.
Oh, okay.
So I always tell people, if you're checking your blood pressure at home, there's a couple important things to remember. First of all, you want to make sure that your your blood pressure cuff is the right size for your arm. If you have a bigger arm, you need a bigger cuff. You want to use an upper arm cuff, not a wrist monitor.
Oh, I didn't know there was a wrist monitor.
There's a wrist monitor,
Oh.
but it doesn't always give good readings. If the device is approved by Hypertension Canada, it will have a nice little red heart with a gold check mark.
Oh, okay.
That's approved. So you want to make sure that you're sitting in a calm environment, that nobody's talking to you, there's not any dogs or cats or kids running around. Yes. And I'm doing the wrong thing here. I have my legs crossed. You want both feet flat on the ground.
Oh, okay.
Yeah, so that's important. And you want to be sitting in a chair just like I am here with your back well supported and your arm at heart level. So I always measure across. And I always say to people, you want to rest for about 5 minutes and then take one blood pressure reading and then always take a second one, because sometimes that first reading is high if you're nervous or you've just sat down and you haven't rested enough.
Yeah. Well, I've noticed that amount because I do take my and you know I keep my feet flat on the floor and I have my arm like this with on the desk next to me. So I think I'm doing the right thing that way.
That's
but you know, at first I was only taking it once and I was terrified. Like, oh, then you look at that systolic die, whatever you call them, and they like I'm going to die tomorrow. You know, so I lately in the last couple of months now I have been taking them twice and I've been waiting like 5 or 10 minutes. And what a difference is. So it really pays to do it twice and wait between. For me personally, I must say that's been beneficial. So I'm not so worried.
Yeah, that's part of it. So you're not so worried. And it's good to get multiple readings. It's also good to take your blood pressure in the morning before you take your medications or have your breakfast.
I think you mentioned that to me because I was taking the medication and sitting right down on the floor doing some exercises.
Yes.
So maybe that's why it was sky.
Yeah, so waiting until after your exercise. And also waiting until, if you've just had a big meal, that's not a good time to take your blood pressure. Wait until after, about 2 hours after dinner.
That much, eh? Just like don't go swimming. But
Yes.
I think that's past, though. I think you can go swimming now. But remember when I was younger, you couldn't swim until a good hour, maybe more, after you had a big meal. So it's kind of, I was going to mention, you said a wrist. I didn't know there was a wrist one. So that's where, remember, when you go to the hospital, don't they still take your heart with your wrist? Don't the nurses come along and still?
They'll check your pulse.
Yeah.
And
pulse.
so
That's pulse. That's different?
yeah, so what's happening with the blood pressure cuff is they use the blood pressure from up here. It's called your brachial artery. This is a little bit technical, but down here, pardon me.
Sure.
Down here, this is your radial artery, and it's just not as big of an artery, and it doesn't get a strong enough response. So that's why that wrist monitor isn't as great.
I can see that now, yes.
It's less expensive, so sometimes that's...
People opt for it thinking, why should I spend a lot of money?
Yeah. And if it's not within your budget to buy a blood pressure cuff, they can come see us here at the Family Health Team. We have some monitors on loan, so we can loan them out for about a week's time. And sometimes you can get a prescription from your doctor, and if you have a drug benefit plan, it might be covered.
Okay.
So that's something to consider too.
Well, I didn't find it too expensive. I bought mine, I think it was only $69 or $70. I didn't think, for the benefit I get from it, it was money, I felt it was money well spent. And that was like 3 years ago. So, I mean, divide 3 into 6, that's $20 a year to keep, tabs on my blood pressure. Well, I'm going to move on.
Okay.
And did we get into this with that? I don't think so. What's the proper way to check your blood pressure in the community, and which types of blood pressure cuffs? I think we've done that one, haven't we?
We've done that.
And our home reading's accurate. Well, they're sort of accurate.
They're accurate as long as you do all the right things. So like we talked about,
with the feet on the floor.
The feet on the floor, your arm at the right level, no talking, resting, and taking the 2 readings.
Okay, so we've done that, Now, here's something. How do you know I never knew I had high blood pressure until, I forget when, but anyways, I didn't think I had any signs. Is there signs that can tell a person? Like, how do you know?
You usually don't.
See, that's it, eh?
Yeah, and that's why they call high blood pressure the silent killer.
Oh, I thought just sugar and salt with the silent killer, but the high blood pressure
High blood pressure is one of the silent killers.
Oh.
Sometimes, if somebody's blood pressure has been very high for a very long time, they can have symptoms. They might start to get swelling in their ankles or their feet, or they might get headaches or bloody noses, and that's really more of a serious concern where they need to come in and see a family doctor or a nurse practitioner, because that's a warning sign from your body that it's been too high for too long.
Okay.
But the average person walking around with high blood pressure probably doesn't know.
Well, see, I didn't. Like, and I felt fine. I was still running around town like I do here, there, and everywhere, you know. So now I'm blessed that it was discovered. But I was going to say, like, so you said like diabetes is kind of connected with high blood pressure. So but don't your feet and ankles swell from diabetes? So how would you discern? Well, I've got diabetes. That's why my ankles and feet are swelling. But in the meantime, it could be the blood pressure.
Right. So usually people who are living with diabetes, they most often complain of pain in their feet or numbness or tingling. So that's a whole different thing. And again, another reason to come in and see somebody and get checked out. More so I see sometimes if your blood pressure has been too high, you can get that swelling, that puffiness. But again, that's more of a serious concern where you should come in to follow up sooner. And that's a big issue too, is that a lot of people say, well, I feel fine, so I don't want to go on medication.
Like, exactly,
Yeah, but it is really important, even if you feel fine and your blood pressure is high and you've done all the right things to keep your blood pressure down, which we'll talk about, then medication is a good option.
Okay, which I'm on, So can we move into that? Oh no, let's skip it. Let's go to this question next. What is hypertension and what causes high blood pressure? I don't think we've touched that. We've mentioned hypertension, but that was at the very beginning when I was introducing you. So
Right. Yeah. Well, we kind of talked about blood pressure. It's those two numbers, the systolic and the diastolic.
Yes.
Hypertension is when the blood pressure has been consistently above that 140/90. Then your doctor will diagnose you with hypertension. So things that can cause high blood pressure, some of it is out of our control. That might be our genetic makeup, our family history. If somebody in your family, your parents or your siblings have had high blood pressure. And sometimes as we get older, our risk for high blood pressure increases. So that's stuff we can't control. But other things can make our blood pressure high too, and that can be the foods that we eat.
Really?
Yes. So
like salty foods.
Salty foods. That's the biggest offender for high blood pressure. I say is salty food, processed food.
Well, I was just going to get into that. Well, then you better be careful when you're buying all this processed and meals already in packages in the frozen food. But that I guess you wouldn't stress strong enough to check the back of the boxes to see how much it would be sodium you would look for, right?
That's absolutely right. You want to check your sodium and read your labels. So salty foods, high sodium foods, highly processed foods can increase your blood pressure. Some other things that can increase your blood pressure could be prolonged stress. You know, if it's just a temporary stressor that we recover from, like a busy day, that's not going to elevate your blood pressure. But constant stress in your life, that can do it. Not exercising enough, not staying physically fit. Smoking, we know, can increase our blood pressure, and drinking too much alcohol.
Oh, okay.
So all those things, we have the power to control those
That's
things.
right. It's not like it's forced on us. Like you're putting that cigarette to your mouth and drinking gin and tonic in your mouth on your own. So it's not something that you can't get rid of if you really care about your health. Yeah.
Well, and
but I mean, a couple of drinks a month, I guess, would be okay. I'm talking about like people that just incessantly swallow like a pint of liquor or something.
So what we say, there's something called the low risk drinking guidelines.
Oh, there is one?
Yeah. So
what would that be?
So for women, that would be no more than a drink a night. And the thing we have to remember is, what is a drink? Because sometimes you go to a restaurant and they offer you a 9-ounce glass of wine.
Okay, so
our lights turned off here. Sorry.
Do we have to go and shake the...
We have to do this. There we go.
This happened last time.
It happens,
Now, where were you? So I can't have a 9-ounce glass of wine.
Yeah,
okay,
so a drink is, and I always have to remember this, a drink is a 5-ounce glass of wine,
yes,
12 ounces of beer, or 1.5 ounces of a spirit, of a hard liquor.
1.5 ounces is the usual drink, like if you're having like a rum and coke or whatever. And then, say that beer again?
12 ounces of beer.
So what does usually come in a bottle? Isn't it is it 16, or is a bottle of beer 12 ounces?
That's a good question.
I don't know either, because I don't drink beer, so I don't
drink beer either.
So
but
I'd hate to throw out 2 ounces down the sink.
You might have to. And same with the wine. Usually in a restaurant it's 6 ounces or 9, but really 5 ounces is a drink.
Well, 5 ounces, that's quite a bit though.
Yeah. The other thing I caution people about too is about mixed drinks, because then mixed drinks have added salt in them. So I looked this up before you came here. A Caesar, lots of people
that's my favorite drink.
Do you want to know how much
Oh,
sodium?
gee, I wonder if I do. Yeah, okay.
I Googled this.
Well, tell me and I'll go home and have a Caesar.
I Googled this. A Caesar has, I think it was, now I can't find it. I think 500 milligrams of sodium per 1 cup.
And how, like that is like, in one Caesar, is that more sodium you should have in a day?
It's about a quarter of your salt intake in a day.
Really?
So no food involved. No food involved.
So what about, like, can you kind of subtract something because it's clamato juice, and isn't fish juice really good for you?
It's still high in salt.
Is it really?
Yeah. So you can consider the nutritional benefits, but I know if our dietitian was here, what she would always say is just eat that food instead. So have a piece of fish
instead of this.
the
You're ruining my whole.
I know. And so, the other thing I tell my patients is we don't have to be perfect all the time, but if most of the time we're aiming for those positive, healthy lifestyle changes, that's the best thing.
Yeah, well, I'm going to have to go home and like, I bet you if I have like 10 drinks in a whole year, like I'm not a drinker, so.
Right.
But I'm going to go home and just measure, not with wine, because then I won't want to throw it out, I might drink it, but with water. In a wine glass, what 5 ounces looks like.
Right, you'll have to measure it out.
Because I have no idea. I mean, I really have no idea. So.
Right, and you talked about how you read your labels, so that's
I do.
That's
I'm
really good. And what I recommend is that people should be looking at the sodium on all of their labels, and so the general rule of thumb is you want to choose items with less than 10% of your daily value. So less.
So your
than
daily
10%.
value is what? Did you say 200?
You want no more than 2,000 milligrams of sodium in a day. And I know that the average Canadian gets about 3,000 to 4,000 milligrams of sodium in a day.
That's really a lot over
That's a lot.
Yes.
And that's mostly, it's not, a lot of people say, well, I don't add salt. I don't have my salt shaker on the table. It's really more so in the foods we buy.
Right, that's right.
The processed foods.
I wish more people would, I went to a session, I think it was given by the health unit, and she even brought like a bunch of packages and even some cans. Like, don't think cans are free of salt and sodium, because they still have. And I was absolutely awakened by it. I just couldn't believe it. And here I'd been one of those that was buying a lot of canned food, never even thinking. So now I'm really, really careful. And I'm glad I am, because I think it's helped my health a lot just by,
So I have a nice fridge magnet that I give to people, and we want 0 to 200 milligrams of sodium is what you should aim for. That's kind of the ideal situation. And then I say anything above 400 milligrams of sodium, you have to put that back on the shelf. It's too much salt in your diet. So that would be that clamato juice.
Oh, yeah. There goes. Have you got anything in alcohol that I could drink if I was so inclined?
A 5-ounce glass of wine.
Well, I know that, but okay, you think that's even better than the 12 ounces of beer.
Well, the other
I'm going to look at a beer bottle to see how many ounces is in a beer, because I think all those beer bottles and cans are standard.
Yeah, I think so. The other little plug I will make is that, part of my job too is with the memory clinic, and we know that as we get older, alcohol can be a toxin on our brain. So really the least amount of alcohol we have in our diet is better. It helps with our heart health and also helps with our brain health, keeping us mentally sharp.
Right.
Too.
Well, there's no doubt about it. Alcohol isn't that the best thing for you. I heard years and years ago, and so this made me kind of think about drinking, that every time you drink a lot, well, maybe not even a lot, maybe just what you're saying, but you lose some brain cells in your brain. Like, so can you imagine over like years how many brain cells you use? Like lose, not use, lose. And that's kind of scary.
Right.
Yeah.
And then the other thing we talked about is smoking. Lots of people have given up smoking, but there's still some people who are smoking. Here at the Family Health Team, we have myself and some other healthcare providers who offer support and nicotine replacement and different strategies to leave smoking in the past. So that's something else that people can do to keep their blood pressure within the normal range.
Well, on the subject of smoking, like it's bad for your lungs. So now I'm really worried about this cannabis. Is that not going to go to your lungs too, just like cigarette smoke did?
We know that it's not good to inhale it.
Well, don't they? Oh, they don't. Yeah. Oh, I don't know. I don't know. I've never smoked cans, so I don't know whether you inhale. Like, I don't know the rule.
Right, and you're right that we don't. That's all that we can say as healthcare providers is we don't. And I have to admit, I'm not an expert on cannabis use. I haven't, checked into any of the research that they've been doing lately. All I do know is we don't want to encourage people to inhale anything. Anytime you're smoking, that's harmful to your lungs.
Okay.
And hopefully there will be more research coming out on cannabis.
I hope it's not too late.
Right.
I hope it's too little too late to
Right.
research.
And that we'll know more about it and we can advise
Well, it
people.
must be popular because I think the government, I think it's the Ontario government, there's a big thing that they're ready to open about another 50 stores or something.
Oh, wow.
You know, like, so the demand is there.
Right.
So don't they know what they're doing? Like, I shouldn't be hitting this.
I know, I'm doing it too.
Promoting it like that if it's bad for your health. We're just
Right.
finally hoping to get people off cigarettes.
Yeah.
You know, and really doing a good job. You can't smoke
Yeah.
within so many meters of a public building. You can't smoke in parks or anything. You know, we've kind of accomplished quite a bit. There's still a ways to go. And here we are letting like another kind of smoke into our system. So I don't understand it. But anyways, well, that's not my problem. It's not. Anyways, I'll go on to. Let's get back.
Those are bigger problems
That's
than we can solve
right
today.
here, I should say. Yeah.
Yeah.
So what can like does I say this is part of this program, thanks to Spotlight, is geared much to 55 plus.
Right.
But to say if anyone watches this on channel, did she signal? No, okay. Watching channel 10 is anyone from 20 to 80 is going to get benefit from this. So I just would like you to tell me that what can we do to keep our hearts healthy and our blood pressure under control? Now I know you've touched on this a little bit, but let's go into it just a little bit more depth, okay?
Right. So the one thing I always talk about is getting regular physical activity, especially for seniors. Really important to get moving and get walking. I always say you don't have to go to the gym and lift weights or anything like that. It can be something as simple as walking or dancing. I know that the senior center and some of the buildings offer lots of seniors exercise classes.
Yes, we do.
I really recommend that. That's a great way to get your body moving as well as get good social interaction, which is good for our brains.
It is, because there's always like the one I go to at the senior centers, there's always like 30, 40 people there, you know, so, and they're very sociable. Some of them stay for lunch after, and some of them sit down and have coffee and a donut or something, you know.
Yeah.
So they're mixing, and it's amazing. We just had a report come out at the we had a senior citizen board meeting today, and we just had a report come out that last year 10,000 some people visited our senior center. So, you know, mind you, a lot of them play cards or pool and stuff like that and go for lunch. But I mean, the exercise classes are really good. But then, and they're only like $1 if you go. Where they're upstairs too in the rec center, then there's a lot more extensive exercises. But I think for us in the, you know, that are a little ways up there. The ones at the rec center are good. They're an hour long, and she gives you she just lets you stop for about 5 minutes to get some water, and then come right back. So the New Horizons is accomplishing that in town. This exercise for seniors. So hopefully, watching this program, more people will take advantage of it.
And swimming is another good activity, especially for people with arthritis. The goal you want to aim for is 30 to 60 minutes most days of the week.
Of any kind of exercise or swimming?
Any kind of exercise. Swimming, walking, dancing, whatever you may do.
Oh, okay.
So exercise, eating healthy, following the New Canada Food Guide, trying to avoid smoking and minimal alcohol. And then also taking your medications as you're prescribed.
And not miss anything.
Not missing any. And if you're having trouble remembering your medications, coming in and talking to your pharmacist about strategies.
They'd be very good, very helpful that way. Yes.
And the big thing I recommend is to choose one thing, especially if you feel overwhelmed by all of the things you have to do to stay healthy. Pick one lifestyle goal. So maybe you're going to exercise more, or maybe you want to reduce your sodium. Pick one thing and focus on that, one thing at a time.
Good.
And then it's not too overwhelming and it's realistic and manageable.
Okay. Well, listen, this has just been wonderful to keep us all informed on blood pressure and hypertension and watching our sodium and not to drink any more Caesars. Okay. So I want to thank you, Brandy. It's been very intelligent. I've learned a lot today too. So I thank you very, very much. And as usual, I will be back with another section of some good health care for seniors 55 plus. Thank you.
Thanks for having me.
You're very welcome. Yeah.